Thank you, Scott. Yeah, so yeah, that webinar, we're looking forward to, I am, and it should be really good. So we usually start with some education, as Scott talked about. And I often try to frame this around things that are going on with our clients in the unit or questions that come up sort of a lot. And what has come up a lot lately, for whatever reason, is eroticized rage and what that even is. And I don't think we've really talked about that on this webinar before. So I wanted to just talk about that briefly because I think people have some misunderstandings about it. And so I want to start by just giving some examples of it. Then I want to kind of do a deeper dive and say how it is, how it happens, and what it does. But basically, I think a lot when people hear the term eroticized rage, which is really kind of coined by Pat Carnes back in the day as a concept. It's very familiar with CSATs and people in the sex addiction world, less so with therapists outside. But I think it's a really valid and valuable concept. People, when they hear eroticized rage, think of, violence and other kinds of things. And it's really not that, although eroticized rage can take strong forms. But I want to give you some of the behaviors that would qualify as being eroticized rage. One that we see quite frequently is voyeurism, right? What does voyeurism do? It's an offending behavior, really, because you're imposing yourself, you're intruding into someone's private life, and there's an aggressive aspect to that in terms of breaking someone's own desire for their own privacy. Watching or touching a person who is sleeping or incapacitated. We see this as well. People that are passed out, people that are incapacitated, people that don't invite to be touched, don't give consent to be touched, and are somehow touched in that sense. Using binoculars to watch people. Again, the voyeurism, but in kind of extreme form, right? And we have guys that go out and do that. Hiding in secret places to watch or listen to people. So in other words, it's kind of covert offending, really is what it is, kind of intruding on people in an aggressive way. Although I guess I call it a passive aggressive way, really, because the person may or may not know about it. Although honestly, with voyeurism, the thrill is the surprise and shock and sometimes horror on the person's face when they see you. That's the dopamine kick for a lot of voyeurs, is that the shock that they see on other people's faces. Touching people, then acting like it was an accident, on the subway or on the street or in an elevator, or just kind of trying to pass it off. That also would qualify as eroticized rage. Stalking, that's clearly one that falls into more overtly aggressive kinds of behavior, but we see people doing this online as well, right? Kind of stalking people online, finding out information about them, doing Google research, and in a very kind of creepy way. Frankly, that's not a good clinical term, but that's kind of how it feels. Using online voyeur websites, and there are such things. Going to another's apartment for underwear, we see this quite commonly, and that sometimes is historical, back to when kids were kids, and they did that, and then that behavior continues. Going into another's apartment, as I mentioned, okay, making inappropriate sexual advances or gestures toward other persons. So just even being overly sexual, making overly sexual comments that are inappropriate, sexualizing someone, talking about them in kind of salacious terms, that's all also considered eroticized rage. Finding sex partners over whom you have power and control. So you get into situations where you're an employer and you're starting to put the moves on people that work for you, or you're a healthcare provider and you make advances toward a patient. All those kinds of things where there's power and control differentials, those dynamics also could qualify as eroticized rage. And then finally, just another one that's more extreme, just revenge sex, right? Where we see people posting things online, exes and old girlfriends. And now there's even more disturbing ability with what's called deep fake technology, where people can go and put someone's picture on another image, and it basically creating, we've had clients that do this, actually create porn out of someone who never even posed in those pictures. So we're getting to that point technologically where understanding whether a photograph is real or not becomes really questionable. So you get a sense of the range of kind of behavior. Some are really overtly offensive, some are kind of more hidden and subtle and covert, but all these are elements where people take aggressive impulses and eroticize them. They get translated into sexual or erotic kinds of behavior. So where does this even come from? And Dr. Rob has done some interesting writing in this. Dr. Carnes has done some interesting writing in this. But basically, what Rob identified, I think, is it goes back to some of the narcissistic tendencies that we see in a lot of sex and porn addicts. Of course, a narcissist is someone who's, it's all about them, right? They're very self-centered and very in the center of their world. A narcissist mostly is created. There's a lot of dysfunction with parents sometimes, often parents who are very, very sick or physically or mentally or unavailable and kind of highly volatile situations. And that can result in narcissism or trauma. But so what happens when someone has a traumatic experience or their self-esteem or their self-image is somehow damaged, as happens in life, right? A non-narcissist, when those things happen to them, that will result often in them feeling embarrassed or feeling rejected or feeling shame. Those are kind of what we might think of as the normal responses. But when a narcissist has those same traumatic injuries, the self-esteem injury, the self-image injury, they may experience that as an intolerable emotion to have that. And so it's going to be directed outward. They escape that emotion and find a sexualized fantasy or behavior that provides them relief from that. So it gets projected outward. And so that's, I think, a key here to some of the underlying formation of these, whether that underlying narcissist tendency is there or not, which can lead to that. So these early life experiences really tend to be the driving forces behind this. And as we've said here many times, and as we see every day, a lot of people, if not everyone, with sex and porn and any addiction for that matter, usually has a lot of trauma or what we might call adverse childhood experiences in the past. It may not be an overt trauma, but it can be things, parental divorce, mental illness in family, a sibling with a chronic illness, that kind of stuff. So all those things can kind of qualify as an unusual household situation where the kid is growing up. And that can be anything that leaves the child basically feeling powerless and kind of searching for that escape via fantasy. And of course, that's the MO for sex addiction, right? Where people dissociate, get into fantasy, and with those narcissists who have that kind of injury, that happens a lot to all kinds of people, that really can get translated into that eroticized rage that we're talking about. Now, what does it all mean, right? And as Rob says at one point in his writing, eroticized rage is not necessarily good or bad, right? It's a thing that does happen. All of us, and this is a normal, when you think about it, everybody, I think this is why it's confusing to people, because everybody can probably have some level of aggressiveness and or passive aggressiveness, and that gets converted to sometimes to their erotic impulses, right? Our arousal templates are kind of full of these highly variable emotions, including a lot of anger. Now, when that does get expressed as BDSM or other kinds of more sexual practices that have violence, that's not necessarily erotic rage, right? Eroticized rage, rather. When there's consent, right? Consensual adults doing things by mutual agreement with a lot of parameters and all that, that's just really considered sexual play. Some of that may be to some of our liking and not to some other people, but it is what it is. But it's not necessarily eroticized rage because there's consent and there's an overt planning with parameters and safe words and boundaries and all that kind of stuff. So there's slightly a bit of different things. So we often, as I say, use dominance, submission, all kinds of things wrapped up into sexual play, sexual acts. That's not necessarily eroticized rage. And that's what people kind of assume it is in the beginning. So I just wanted to clear that out. So basically, I think as sex therapists and certified sex addiction therapists, we're what I consider sex positive, meaning we're basically open to different forms of sexual expression with whatever that means for someone, as long as it's consenting and as long as people are adults and able to give that consent, right? Now, obviously, those behaviors can cross the line, and that's why when people do get involved in those behaviors, it's very important to have clear parameters and agreements and no drugs and all that kind of stuff. So everybody's in the clear-headed space when they can do that. But so anyway, when you hear the term eroticized rage, think more of aggressive, even hostile instincts that are kind of channeled into more covert, passive aggressive, sometimes overt, but kind of not overtly expressed as angry, aggressive sex, but more the subtle things that we mentioned, like voyeurism and exploiting people in that kind of Me Too movement fashion and so on. So I think that was important to clear up for people, and hopefully I haven't introduced more confusion than I wanted to. So.
Thank you, David. I've got a couple questions. I didn't hear you mention exhibitionism, but I assume that falls into eroticized rage. Okay.
Totally. And by the way, exhibitionism is the real one where people, the high from that is the shock on somebody else's face, right?
Yeah.
I flash my trench coat and I get off on the surprise that somebody has. Yeah.
So a couple more questions. Is eroticized rage, is it about control, or is it about anger, or is it about both? Is there a way to delineate?
I think it's, as I kind of laid out, the source of it is this need for fantasy and escape. And I think ultimately that is a means to control. It's a way of controlling pain, shame, injuries to self-esteem, a lack of control, all those things. So yeah, absolutely. So it's a need for control. It's a way to kind of take it back, but it's in very indirect roots, in the way that it's not overtly expressed. It's not negotiated. It's not talked about. It's not even handled in a healthy way. Those impulses are kind of driven into this underground way. So I think it is all about control. And as I say, it all starts with this need to kind of control, manage the self-esteem injuries or the shame or whatever happened, usually way back. That gets repeated, by the way. That we tend to continue to have those experiences sometimes and repeat them the same way, or the same eroticized rage behaviors.
Yeah. Couple more. Parental enmeshment with a child. In the Ken Adams version, we used to call it covert incest. Is that a form of eroticized rage from the parent to the child? And is that child later likely to engage in various forms of eroticized rage? Because most covert incest or mother enmesh men that I know were sexualized by the mother covertly. So I'm wondering how eroticized rage plays into that part.
Yeah, I think very often parents who have poor boundaries like that and kind of eroticize their kids or get enmeshed or incest, covert or overt, they also have experienced those issues, I believe, where there was a lack of control over feelings of shame in their own childhoods. And I think that behavior gets directed outwards, and it often gets directed outwards at kids. And it's really, we often talk about some of these dynamics as being intergenerational, and it's true. It gets passed down, and that child is going to grow up as well, right? Because nobody's learning healthy ways of expressing anger or feelings or managing boundaries or being role models. It's all kind of mixed up, and I think that just gets passed on. But yeah, these dynamics of eroticized rage, anger that gets passed on, and and it can be when we say covert, it doesn't necessarily mean even touching. I think a lot of times people, like when they assume eroticized
usually
rage,
there's not touching. That's overt.
Exactly. So it's crossing boundaries or describing your sex life with the other parent,
Right.
with the child, that kind of stuff. Just no good clear boundaries.
Yeah. Yeah, we could probably spend a whole hour exploring that. But two more quick questions. And you and I have both seen this quite a bit. at the treatment center and work groups and in your private clientele. People who spy on their partner or sneak pictures of their partners or videos. So that's part one of it. And then part two of it sometimes is whether they've covertly gotten those images or whether they've, gotten them through, gifts from the wife or the husband or whatever. They will use those to go online and pretend to be the wife or the husband or the person who's in the pictures. Is this, when it is your partner, and there's definitely a secretive element here, it's certainly in a lot of ways an offending behavior.
Sure.
Does this fall into the category of eroticized rage, or is this just a weird fetish? What are we talking about here?
Well, certainly there's a seething anger in those acts, right? Just a total disregard for somebody's privacy and taking that and using it. And often it is taking pictures that were either meant to be totally private between a couple, or the partner doesn't even know the pictures have been taken or shared. So I would definitely say that's eroticized rage in my mind. There's an element of anger and aggression there that is totally used for an erotic energy, right? An erotic impulse and a high, if you will. And so, but it's definitely has that hurtful component to the person who may or may not know they've even been victimized in that scenario you just stated. But I would definitely call it eroticized rage, or it could easily fall in that category. Yeah. It's just such an angry act. And ironically, the people that do a lot of these behaviors that we started out describing tonight don't see themselves as angry at all, right? They don't feel anger when they're doing it consciously. Although I think if we really probe into that, they can identify, that's kind of a hostile act to do towards someone. Yeah. But in the moment, their erotic arousal trumps all of that care.
So are there sex addicts who I'm talking about sex addicts now, are there sex addicts who do not display eroticized rage, or in your experience is pretty much every sex addict displays some degree of this?
I think probably everybody has some degree of it. We measure it in a lot of the different assessments we do, and some people have really high scores and some people have relatively low scores, but I don't think anybody is really zero on that. I think just some of these behaviors, people have their own specific kind of behaviors that rise to the top in terms of their favorites, and not everybody does exhibitionism or voyeurism or looking for underwear in people's drawers or anything like that. That's not everybody by any means, but the impulse, I think, for power and control is something that we often see almost universally with sex addicts, where they take advantage of position or those kind of dynamics. And I think there's an element of anger under there as well. So I would say yes. I mean, I'm sure people could point to somebody that had none displayed, and as I say,
there's always an exception to the rule, but
right. But I think for the most part, yeah, to greater or lesser degrees, for sure.
Yeah. One last question for me. I promise this is the last one. Once an element of eroticized rage makes its way into your arousal template, or more likely is uncovered within your arousal template, we've talked about that. It's there to stay, correct?
Right. So when we talk about the arousal template and these kind of high impact, high dopamine activities, sexual activities, they represent real hotspots in the arousal template. And those, because they're often reinforced a lot in the course of the addiction, those are very rarely we're able to kind of purge those or get rid of them. The arousal template is kind of a collection of things that we've experienced as erotic over the course of our lives. And they really don't empty out. It doesn't change. It just kind of adds, it's cumulative. And so those are there, but those are elements, those are hotspots, if you will, in the arousal template that we as clinicians work very carefully to help people develop strategies to either avoid or to kind of diminish or to contaminate in terms of kind of ruining the cherry picking of all the good memories about some fantasy and ignoring all the other stuff. But yeah, those are pretty much permanent. And so we recently had somebody well, several of the scenarios we've mentioned tonight, we've had people recently, and we've had to talk to them about how those urges might be with them for a long time. But I have found that as people get healthier ways to express themselves emotionally, especially if they're having anger, or remember the flip side that gave birth to these things, the self-esteem injuries, the shame, as people learn to deal with that and process that in a more healthy way, I think the drive for some of these eroticized rage behaviors lessens, but I wouldn't say it goes away. It's something people always have to be watchful for.
Yeah. Okay. Thank you. We've got a couple questions left from last week, and I promised we would do these first this week. So we're going to do these, and this first one kind of maybe fits into today's theme. This is from the partner of a sex addict. This individual says, I feel extremely shameful that I have watched pornographic videos that mimic my husband's acting out, and I have become aroused by these videos, even when those actions have severely hurt me. Sometimes I felt like this was the only way I could get aroused, usually when he was acting out. Am I just seeking pleasure from unexplainable pain, or could this be a deeper issue like a self-harm behavior? Interesting question.
Wow, that's a great question, and it weirdly fits into tonight's topic. So there is a phenomenon that a lot of partners will be familiar with called pain shopping, right? Where partners will go off in search of more information, more details, hanging on to, they'll read, texts from their husband to their affair partners or whatever, just and kind of live in that pain thing, right? So that's a phenomenon here, and this scenario that the person posed in this question has a little bit of that flavor to it, kind of indulging in that. But I think also when we think about, and it's kind of an interesting example because it gives an example of how people can kind of get aroused by something that has an aggressive undertone to it, right? I think looking at that kind of porn, getting high on it, and as it relates to the husband's activities, I would say that definitely has kind of an eroticized rage. There's anger at the husband there. There's shame. There's self-esteem issues. There's hurt. So I think a lot of ways of dealing with those feelings is being channeled into that behavior. And I would suggest gently to kind of leave that behavior if you can, if you're still here tonight, because I think that's just causing you nothing but ongoing pain. And it's not really solving anything except perhaps driving you deeper into a problem that's going to be more difficult for you to extract yourself from down the road. So I think, yeah, there's definitely an example there of how we seek these behaviors to soothe ourselves, to get some kind of comfort, but there's kind of an aggressive aspect of that underneath too.
And how does this relate, and maybe not at all, to the fact that victims of childhood sexual abuse will often sexualize the abuse. It enters their arousal template and becomes often integral to it. Is that what we're seeing here, maybe, or is this something completely different, or too hard to tell without further exploration?
I think it's probably too hard to tell. The dynamic you're talking about, where somebody experiences abuse, and then over the course of their lifetime they tend to repeat that, the traumatic repetition, those kind of phenomena. This doesn't feel like that to me, just based on the question, but it's really hard to say.
Okay. I'm interested in your perspective on showing kindness and compassion to my wife. I'm working through my stuff, but I seem to never get ahead of her grief, and I'm constantly living in the weeds instead of working through all the trauma that keeps recycling. Is there a light at the end of this tunnel, or is there some other approach to fixing this issue with shame, guilt, and blame?
Great question. I think it's an ongoing struggle for a lot of recovering sex addicts to really get a handle on compassion and empathy and even kindness. As weird as it sounds, because I think most guys in early recovery really want to do that, and they really struggle with it. We see that with people in our residential program in Los Angeles, where they're really, really connecting with the feelings of what they've done, the harm and damage they've done, but they don't know what to do with that. And we know that sex and porn addiction, and actually amphetamines as well, really hamper the ability to feel and connect. And so it's part of it is due to the addiction, part of it may be that they never learned how to do that in the first place, part of it may be the narcissistic threads that go through people. So there's a lot of different factors that explain that. But I think one of the big challenges is really learning how to have compassion and empathy for your partner. That starts ironically with compassion and empathy with yourself, right? The idea of, we were talking about this earlier today with the unit. Empathy is defined as being able to feel what somebody else is feeling. If I, as a newly recovering addict, don't even know what I'm feeling myself, it's really hard to be able to identify with someone else's feelings, because the feelings are just kind of a mess, like a new foreign language with me. I don't really feel them myself, let alone feel them on my body. So the key here is often to really get well-versed in your own emotional landscape, including where you experience feelings in your body. And once you get a handle on that, it's much easier when your partner says they're feeling something, or when you intuit that they're feeling something, you can relate to it. If you don't know what that feeling feels like yourself, and remember, most addicts, let alone sex and porn addicts included, we don't want to feel anything, right? We avoid those feelings. And so we haven't had much practice at feeling pain, at feeling hurt and fear and all that. And a lot of that does come crashing in early recovery. I have found that there are certain skill sets like DBT, we've mentioned that I think here before, dialectical behavioral therapy, that looks at the skills to start practicing compassion and empathy. And they go through sort of basic informations like things like I want, you want, and how to differentiate that, and kind of learning these basics that I think a lot of us addicts kind of somehow missed along the way. And so there are some remedies. So to the reader or the person asking a question, I would suggest maybe looking at or ask your therapist about some DBT work or some other skill-based practices where you can start practicing the skills. Because I think, and we have a slogan in 12-step program, act as if, right? It may not come, something may not come naturally to you, but if we just act as if and just do it, eventually it will feel natural. And the same argument can be made, I think, for compassion and empathy. If we just learn the skills and learn how to do it, even though in the beginning it feels awkward and we're not sure if we're doing it right and we're not getting the feeling as much as we would later, we will eventually, it starts to connect. So that learning the skill is really important.
Okay, let's jump into the Q&A feature. Thank you, gentlemen, so much for doing this. It helps so much. Okay, you're very welcome. We love doing this. Yeah. Let's see, is it necessary or of therapeutic value for the sex addict to understand the root of his sex addiction, the precipitating events, etc.?
What a great question. Because I would say probably every client we get coming in, the thing they want to work on is why, right? Why am I doing this? Why is this happening? Why? Why is an important question, but it's not the first question. Right. Just to follow up on what I kind of just said, I don't necessarily have to understand why I do something to change that behavior. What I need to do to start is to change the behavior. And I may not know why I did something originally or not, but I think that isn't a prerequisite for actually starting to make progress in changing the addictive behaviors. Now, eventually, in order to avoid relapsing or switching addictions or getting into some other kind of trouble, it is important. The why does become relevant. The why does become relevant so I can understand how I got in this place so I can avoid coming back. And that often involves working on trauma and other kinds of issues from our past, right? Because again, sex addicts, any addict is made or created, right? We have a genetic tendencies, but a lot of people have genetic tendencies and never become addicts. There's a certain set of circumstances and patterns, and often childhood stuff, as you'll hear us talk about a lot, that create an addict. However, to get into recovery, it's not essential to know the why. It's really not at all. Now, as I say, down the road, it is important. But I think the first question is how? How do I change this behavior? What do I need to do? And then we can worry about it. So but it makes sense. Of course, everybody wants to know, well, how did I end up in this place? And I think the goal here is to avoid, ending up there again. And so we go for the why. But as I say, it's really what or how are the more important questions I think it would be.
Yeah. And just to kind of tack on, the usual precipitating factors are some form of early life trauma, family dysfunction, neglect, abandonment, abuse, early exposure to sex, whether or not it's abusive, whether or not there's physical contact. There's a whole lot of research into the causes of addiction. The biggest risk factors are family dysfunction. There's alcoholism in the home, or there's an addiction in the home, or mental illness in the home, and then early exposure to the substance or behavior. But yeah, and usually early exposure, even if people don't view it as abusive, when they look back, it's like, my uncle showed me porn when I was 7. That was kind of abusive, but I thought it was cool, but we dig a little deeper and
incest, my mother talked about her sex life with my dad, but
right.
I thought it was weird, but
yeah,
those kind of things can really plant a seed.
Right. And until we address the underlying issues, the research shows people with 4 or more traumatic childhood experiences are like 11 times as likely to become a heroin addict as just someone who didn't have 4 of them. We're more likely to be depressed. We're more likely to be anxious. We're more likely to have
lifespan. Yeah.
Over the course of the lifespan, and we're much, much, much more likely to become addicted. And usually whatever we were exposed to early, if it was alcohol, we tend to become alcoholic. If it was drugs, we tend to become drug addicts. If it was sexual, we tend to become sex addicts, but not always. And we do need to uncover and, as David said, address those underlying issues, because they are the issues that drive us toward escape. And if we can address and process all of that trauma, we're not as driven toward escape. It's much, much easier to stay sober long run if we do that extra level of work. So let me ask you one more question, David. We don't jump into that at the treatment center, because we don't have enough time to work through it. But at some point, and I know everybody goes away with their aftercare plan, we have identified usually most of their trauma, but we haven't processed it. They take it back to their individual therapist and work on it there when the time is right. When is the time right?
Great question. I think it's a little bit variable, but I think basically what we're looking for is when the person in recovery has established new coping mechanisms, new coping tools, new skills, new resources that can enable them to handle rougher kinds of emotions, right? And I think, and you're right, we don't do that because in early recovery, our addiction has been our coping mechanism. We've taken that away. So there's a kind of a period of adjustment where people have to kind of learn how to deal with feelings and how to manage stuff without getting their circuits totally overloaded and slumped. So what we do, and so you're right, we don't do trauma therapy. What we do is what's called resourcing. And I'm a trauma therapist. I do EMDR, hypnotherapy. And before I ever start doing a trauma session with somebody, I do what's called resourcing. And resourcing is really giving people tools, helping them check in with their body, helping them learn how to breathe and regulate stuff, learning how to bring themselves back if they get triggered, that kind of thing. Just those basic skills are really critical for the person to be able to walk through a trauma session with a therapist and feel confident and not like they're going to lose it should they come across a painful emotion, which they will. And so to answer your question, I think it can be soon, right? I think a lot of people have had a lot of work already, but I would say, even 2 or 3 months wouldn't be too late. But I definitely the first month or 2, I'd be very cautious about it. And as I say, we start right away with some of these resourcing activities, but we don't actually do the trauma.
Yeah, I mean, addiction is a coping mechanism. It's about emotional escape. It's a form of emotional escape, and it's our go-to. And usually when we get into recovery, we have no other coping mechanisms left. Anything that we used to know how to do, we have forgotten.
We just
We
didn't feel
only
it.
have the one thing.
Yeah.
And so suddenly here we are having all these feelings because all of our past trauma is coming up, and we're remembering things that we had pushed away. You know, all kinds of things happen, and it's really painful. And like David said, we need to develop some coping skills. You know, there is such a thing as too soon, and too soon is when I don't have any coping mechanisms that are healthy. So I love.
It can
Go
be
ahead.
tragic. I've had clients who seriously relapsed on drugs because some well-meaning therapist got into trauma work too soon, right? They didn't have a keen eye to evaluate, is this person ready or not? So yeah, we got to be very careful.
Yeah, there's a window of tolerance that a recovering addict has, and if we push them out of their window of tolerance, they're going to relapse.
Exactly right.
And it's almost inevitable. And it's kind of like you said, therapists push too hard, too fast. It can be damaging. So, and I have guys, you know, I teach our online work groups, and a lot of the guys, they have an individual therapist, which is great. It was a CSAT, but they also have a trauma therapist. I'm like, okay, forget about doing trauma work, except go to your trauma therapist and start talking about coping skills. Like David said, let's teach you how to deal with everything that's going to come up. So yeah. Okay, next one here. No question, just a thank you for your time and dedication. Again, you're very welcome. People are loving us today. It's really good for my ego. Is it working for you, David?
Yeah, it's working. I'm loving it.
Yeah. My therapist thinks that I use sex and porn as a coping mechanism for a multitude of things. Do you have recommendations on developing healthy ways to gain the life skills to aid in recovery? You want to elaborate on that, David?
Yeah. Boy, that's something we were just talking about. So
yeah.
So I agree with your therapist. I mean, our addictions, as Scott just said again, is the way we cope, right? We cope by not feeling, by pushing or aside, by avoiding, by distracting, all that stuff, but not feeling it directly. And so the kind of healthy ways to deal with skills, I think, boy, there's a multitude of them. I think going to any 12-step meeting, you're going to start to pick up a lot of them, just the basic ways of managing triggers, cravings, and so on. And remember, I always say 12-step program is not therapy, so I think therapy is also important. But I think therapy is where we start to really look at that and develop these skills. And I think part of it is just learning how to deal with my insides, right? The feelings that come up, because a lot of these feelings are going to be new. Unfortunately, life goes on. When we get in recovery, it doesn't stop. It doesn't give us a break. So we may continue to get, people pass away, our dogs get sick, we lose jobs, kids move out or whatever. And so there's a lot of strong feelings that are there that we have to practice with, to practice our skills. I think working with a therapist, working with a sponsor, going to meetings, going to a group, if you have access to a group, a men's group, I think that'd be an amazing experience to do that. And group, I believe, is the single most powerful intervention we have is seeking integrity. And I think if you can maintain that group dynamic when you go home, even better. As I mentioned before, DBT has a lot of skills-based stuff that addicts find helpful. Although finding good DBT therapists can be sort of hard to do sometimes. There's other kinds of therapies out there that I'm starting to see more and more, which I think are also very valuable in terms of helping people frame what's going on and get these skills, like internal family systems, the IFS, that help people kind of figure out, okay, well, that's this part of me and that's that part of me, and how do they work together? And some of these are models that help people kind of understand the bigger picture. And that also, I think, is hugely important too. So if I understand what's going on with me, I can start to figure out when I need to use what tool to intervene. And so I think just experience, keeping an open mind. We talk about beginner's mind here sometimes, where beginner's mind is simply approaching everything with no preconceptions, just going in and saying, okay, this is what it is, not that this is stupid, or I have to do this, or what does this mean, or whatever we do as addicts to argue with stuff. But just be open to the experience. There's all kinds of places we can get those skills, but I think the primary ones are therapy, 12-step meetings, and working with sponsors and other kinds of peers. Scott, what do you?
The number one useful coping skill for me is reaching out to other recovering addicts, always. Working the 12 steps of recovery, you mentioned life skills that to aid in recovery. The 12 steps of recovery, there's a book that Everything I Need to Know I learned in kindergarten. And it's a lovely little book, but I didn't learn those things in kindergarten. I learned them from the 12 steps when I was in my late 30s. Because I never grew up. As soon as I started drinking and drugging and chasing sex, I stopped growing up, and I had to learn things. Group therapy, online work groups, coming to treatment with a group of guys, and getting a home group in a 12-step meeting, that will help immensely. And working the 12 steps for sure. Yeah. So plus, all the grounding skills and meditation and yoga and exercise, all that stuff is great.
No, exactly. And depending on individual circumstances, right? Sometimes people have an anger issue, or they have anxiety or depression or other things that they also have to address. And I think taking those into account as well is really important, because if I'm fighting an anxiety disorder, it's going to be, swimming against the current to try to get some of these tools in place. So taking advantage of everything we have to offer for the bigger picture, right? These other complicating factors like depression or anxiety or whatever that we have to take into account as part of our recovery.
Okay. Next one here. I love my wife. I know that in my soul. But my inconsideration, inconsistency, forgetfulness, and lack of transparency makes my wife believe I only love her for what I can get from her, like I love a car. I put her away when I no longer have a use for her. She keeps asking me to admit to her that I don't really want her or a real relationship. I feel I do want that more than anything, but I'm starting to think I'm fooling myself. Can you please comment on this discord on my feelings and actions? So I think this is commenting on this individual's internal discord on.
Yeah, so it's a great question. I think it's not one that's very unique either. I think a lot of people experience this, and part of it I think could be explained by the fact that we are in recovery. We kind of awaken to feelings, and we don't really know kind of how they work and how we feel them, experience them, and deal with them. But it goes a little deeper too. I think sometimes we as addicts make choices for reasons we don't totally understand, or for the wrong reasons, or whatever. I think people often say, their choices might be different. That doesn't mean that the marriage is wrong by any means, but I think we grow in any long-term relationship, right? We get together and we hopefully grow together and develop together. The other thing I think that complicates this scenario is that again, the internal process, that discord internally, you're talking about that intra-psychic discord, can be really partially explained, at least, by how we think about ourselves. I had mentioned earlier how important it is to create a relationship with oneself when we're trying to develop compassion and empathy. And I think if we don't have that, if we're just focusing on our partner as we need to in any good relationship, right? But if we're disconnected from ourselves, it's going to be much harder to show that kindness and courtesy and compassion even toward that other person. And most often, I think addicts have a hard time accepting that they're worthy or lovable, or having a hard time receiving the kind of back and forth that happens in any good emotional relationship, right, where we give and take. And I think that's kind of all lopsided. So I believe and trust your internal feeling that you love your wife more than anything. I think the problem is that you're not really feeling that yet, and it's even harder to express it. And so I would really work on connecting with your own feelings. I would look at those compassion and empathy skills and just remember, start learning how to express that, even though it may not be totally feeling normal to you, but start getting in the act of practicing the techniques of reaching out. I think, you obviously have an awareness of these things. So even if it's not totally coming from your heart, and I believe it is, by the way, I think there's a disruption in the flow from your heart. But I think if you could just start going through the motions, that would make a big difference, and it would help everybody. Because right now, remember, for any addict, talk is cheap, right? And most addicts have used gaslighting and all kinds of other verbal stuff and apologies, and just words don't mean much, but actions do. And actions over time, that's integrity, really. And I think that's where I put my effort into learning the skills, starting to practice them, and then working internally to see how I can connect more accurately with my feelings that I believe are there. Wives of spouses of any addict really are dubious and suspicious, and it takes a long time to earn back that trust. It's not going to happen quickly.
Yeah, I mean, I tell guys a lot, early recovery is an emotional roller coaster for you. It's also an emotional roller coaster for your wife or your partner. And unfortunately, it's not the same roller coaster. So you might be feeling a whole lot of love right now, and she may be thinking, I hate you. And tomorrow she might think, I love you. I don't know why I said that horrible thing to you yesterday. And that's normal for betrayed partners, by the way. Betrayed partners, there's research on betrayed partners. Barbara Steffens and Marcia Means did this particular study that I'm referencing. They wanted to know what happens to female partners of male sex addicts. And they found a couple things, the most important of which is they display post-traumatic stress disorder symptoms. You can read all about this in Dr. Rupp's book, Codependence. He really covers this. He also covers it in Out of the Doghouse, but Codependence is a great book to read if you really kind of want to understand the healthy relationship. And it doesn't mean that necessarily that they have post-traumatic stress disorder. If it continues for 6 months or more, then they probably do. And I think a lot of betrayed partners do suffer post-traumatic stress disorder. And in post-traumatic stress disorder, it's called emotional lability. It's I love you, I hate you, I love you, I hate you, come closer, go away. It's just all over the place. And it's because they're in a crisis that they cannot control. And they're deeply wounded. And people in crisis do not always make good decisions or we get a little crazy when we're in crisis. I remember when I was growing up, we had cats, and one of them got my father right on the vein in his wrist, and he was literally spurting blood. So we pile into the car, and I was about 14, and I was driving because he was spraying blood all over, and he's giving me the wrong directions to the emergency room. And I was like, Dad, no, it's over here. And he's screaming at me. And so I went where he wanted to go and said, it's over, and this was a grown, sane judge, for crying out loud, who puts his 14-year-old behind the wheel of a stick shift and gives him bad directions. Because he was in crisis. And betrayed partners are in crisis, and they will say things that are really hurtful. I can tell you're hurt by this statement. And probably in the moment, she may have meant for you to be hurt. But yeah, I don't know if I'm adding anything useful, David, but I just want you to know this is sort of a normal dynamic for sex addicts and betrayed partners in early recovery to have this, push-pull a lot of the time.
Right, totally. Yeah.
So I was hoping you could make sense of what I just said.
No, for sure. I agree with everything you said, and it's true, because people in crisis are have that lability you mentioned, and they're not grounded, and that's, you know, a problematic situation. What I was thinking actually was we talked earlier about when to ask why and when to ask what and how, and people in crisis, and an addict coming in treatment is in crisis. Crisis therapy is not delving into the past and digging up the history. Crisis therapy is in the here and now, present tense. Like, what are we going to do to get you out of crisis, right? To stop your father from spurting blood, or an addict, you know, to deal with, to stabilize you in this crisis when people usually come in under all sorts of circumstances, and never good ones, typically at home. So that's really important to understand that everybody's operating from a very heightened emotional state here, and that it's very difficult to manage, and that people kind of talk past each other sometimes. That's why I think a check-in, a routine daily check-in, is really important. And it doesn't have to be huge and elaborate. It can be 5 or 10 minutes, but just to maintain that connection. And the parallel I often use, you know, I had a hard time reaching out when I first got sober, and I learned quickly that I need to call my sponsor when I'm feeling good, because if I'm feeling bad and I haven't been calling him, I'm never going to pick up that phone, right? And so that check-in on a daily basis really is a way to stay connected, and that'll carry you through times when the emotions get higher, you know, the intensity gets high. That you have an established pattern of talking to each other, and that's a more grounded way of handling these issues than in the heat of the moment, for sure.
Yeah. Okay. Probably one more here. I'm a porn and sex addict in recovery. During my addiction, I was seeking sex with men, no penetration, and I don't understand why. I was molested at least once by a priest, if not more often. My memory is failing so much about that period of time. Was I being passive aggressive by trying to get even with men? So I don't know if this is an eroticized rage question and passive aggressive question. They could travel hand in hand. I mean, what's going on here? And before we even begin, it is common for sex addicts, sex addiction to escalate into same-sex behaviors or trans or all kinds of things. So, okay, now I'll throw it into your court, David.
Totally, and I just want to say, you know, a lot of spouses, of course, is my husband gay, right? And it's very common to broaden the scope of sexual partners as a result of tolerance and escalation that happens. We see that a lot. You know, this doesn't feel like it's passive aggressive to me at all. I think, or even getting even with men, I think if there's a bit of eroticized rage here, and there may be, it's that would have some hostility at it. But your actions to me, by getting involved with men to a certain degree, really speak of, to me, it feels like kind of echoes of the past. I would lay that to your abuse as a child. And as we mentioned earlier tonight, when that abuse occurs, the original term, John Money, who really did the original work on arousal templates, he called them love maps, but same thing. He talked about abuse really hijacking the arousal template. And when that happens to a kid, their sexual tastes, their sexual urges, and their sexual confusion get kind of laid down in the arousal template, and you'll see it play out. So I think these are probably parts of your arousal template that we're seeking, maybe there's some curiosity, maybe as part of your escalation and your addiction, you started acting out on those. So I think there's all those possibilities, but I think it doesn't feel to me like kind of getting even with men. I think people are usually either more overtly angry with their abuser, or they were confused by it, as Scott mentioned as a possibility earlier. People can be confused because it wasn't violent, it wasn't even painful. It was attention from an adult in a world where they probably weren't getting very much attention. And sometimes that weirdly feels good while the kid knows it's wrong. And so it's very confusing, if nothing else. So I think it's something to work on with your therapist. But I also think sometimes when we're trying to figure out why, in a case like this, there's no no easy answer that we're ever going to discover. So I don't know that I would go off on a deep journey to find out. I think it's, I think if it comes up as a product of your trauma work, great, you'll have some more information. But I think trying to explain it, looking back, is very difficult to do sometimes. But it does, to me, it just personally doesn't feel like passive aggressive behavior in this scenario.
Sorry, I muted myself. It's normal for victims of child sexual abuse to incorporate elements of that sexual abuse into their arousal template. A lot of times they will either consciously choose to not act on those, as with like a same-sex attraction, particularly with somebody who's straight or at least mostly straight. But addictions escalate. They take it. Nobody starts out wanting to be a heroin addict. No 12-year-old kid ever said, I want to be a heroin addict. They want to be cool and smoke a joint. And 10, 12 years later, they've escalated to heroin or, meth or whatever. And sex addiction escalates the same way. And along the way, we uncover existing elements of our arousal template. And we become more aware of them, and sometimes we act on them. It doesn't change your sexual orientation. It doesn't mean there's something wrong with you. It means, you were molested as a kid, and that worked its way into your arousal template to some degree, and your addiction escalated. You needed more taboo, more intensity, more, craziness, and you ended up there. And this is when I say it's fairly common for sex addicts to escalate into things like same-sex behaviors or same-sex porn or trans behaviors. It's if it's in your arousal template at all, you will find out as part of your sex addiction. And we end up going places we would not have gone without sex addiction. And it doesn't make you any more or less straight or gay or bi or whatever. And hardly anybody is completely straight or completely gay. Most people are on the spectrum in between. So, I just want to normalize this whole experience. It's just not that unusual given the circumstances.
Right. Totally agree. Totally.
Yeah. Okay. We are out of time, and we're also out of questions. So we timed it right for once. David, thank you. We will be back same time next week, same place, same time. Anything you want to say to check us out?
No, just great questions as usual. Thanks, everybody. And yeah, keep coming back.
All right. We'll see you next week.
Thanks, Scott. Take care.